The following portion of Daytime is sponsored by the Jasin Facial Rejuvenation Institute. Welcome back, everyone. Is your face starting to make you look older than you feel? If you're interested in reducing the signs of aging, but you're not ready for surgery, the answer could lie in laser skin resurfacing. It's not a one-size-fits-all type of procedure. There are different levels of resurfacing available. And here to tell us more about it is Dr. Michael Jasin from the Jasin Facial Rejuvenation Institute. Nice to have you back, Doctor.
Thank you.
Let's talk about what kind of problems can be treated with laser resurfacing.
Okay, well, lines and wrinkles would typically be the most common thing that people come in for. Hyperpigmentation or brown spots due to sun exposure or genetic tendencies are treated nicely with the laser. Acne scars are another popular problem that we treat with laser resurfacing, and sun damage. So the nice thing is we can remove that sun damage and get fresh, healthy skin back on the face.
Well, the results are pretty dramatic. We've got a before and after that we just have to show. And this woman has not had a facelift, right? This is just with the laser resurfacing?
That's correct, just resurfacing.
Tell us about what you did, and is it a powerful laser that you're using?
Well, we use what's called an erbium YAG laser. And the nice thing with this laser is we have the latitude to be very aggressive for deep lines and wrinkles and get good results with that. But we also can back off and do very light treatments and various stages in between to get the program or energy settings for the laser matched up with the patient's needs and desires and their time constraints. So it's not like everybody has to devote 7 to 10 days to healing anymore. We can get a lot accomplished with a few days of healing if need be. So
a job like she had, though, I mean, what kind of healing would that take, do you think?
She was probably about 7 to 8 days before getting back in makeup.
Okay, well, our next lady, she looks great too. Not as many wrinkles that you dealt with on her face, but tell us about how long that healing would have taken and worked on her face.
Okay, well, this is a full face procedure that we did for her, as we did on the first young lady, and we were a little more concentrated on the area around the mouth where she had the deepest lines, and I think we have a photo of the close-up of that.
Yes, we do.
So the energy settings are higher in the areas where the lines and wrinkles are deeper and where we have to be more aggressive. In the areas where the lines and wrinkles are more superficial, we can use lower energy and not prolong healing any more than necessary.
I'm thinking the skin's a little thin around the lips. How much are you feeling when you're undergoing this procedure?
Well, it depends. Now, a lot of these procedures that are more superficial we do under local anesthesia with just a topical anesthetic. For the intermediate ones, we may give some Valium orally or do some sedation through the IV. For a more thorough treatment like these first two young ladies had, we usually would recommend IV sedation, which is like a twilight sleep.
Okay.
So you're drifting in and out of sleep, but you're breathing on your own and so forth.
That's good. And then do you leave that day as well? It's just
yes,
you're in and you're out?
Yes, come an hour before we do the procedure, put the topical anesthetic on before the procedure. Recovery, if they have sedation, is about an hour. If there's no sedation, and when we're done with the procedure, they're pretty much on their way.
You mentioned acne scars, and we have a before and after of someone you treated, and I know a lot of people are dealing with this, and let's talk about the laser that you would use for something like that. If it is quite severe, does it mean you only need one procedure, or do you go back for a few, or how does that work?
Well, for the deeper treatments, typically we're doing one session. Now, with acne scars, they can be a little more problematic in order to get the best results. So not uncommonly, we may look at doing a series of treatments for patients with acne scars because it's a little bit deeper problem and a little more difficult even than the lines and wrinkles. The other scenario where we would do a series of treatments would be for someone who can only take a few days at a time to heal but wants to get a little more accomplished. So we may do a series of lighter treatments spaced out to get results similar to what we would do with one deeper treatment.
And that way you don't have to take a lot off either. You can be back at work. If you get it done on a Friday, could you be back on a Monday, realistically?
Absolutely. Actually, right after this, I'm going to the office to do a procedure on a patient who's a pilot, and we'll be going back to Detroit. So she needs to be healed in 3 days, and we have a program designed to do that for her.
Are the results permanent?
Yes, they are, and the results will last longer if the patient practices good skincare after. So if they don't abuse themselves in the sun, they use proper products on their face and take care of themselves, the longevity of the results will be that much greater. Okay, Dr. Michael Jasin of the Jasin Facial Rejuvenation Institute, thank you very, very much. For more information on what we've talked about today, you can call 888-815-3223 or log on to jasinfacial.com. Thank you very much. Thank you.